Good morning. Welcome to today's COVID-19 briefing. This one is on cleaning, safety, and building operations. I'm Robin Kaler, Associate Chancellor for Public Affairs. I'll be moderating today's discussion. Let me start by introducing today's four panelists. We have with us this morning Matthew Tomaszewski, the Executive Associate Provost for Capital Planning, Mohammed Atala, the Executive Director of Facilities and Services, Brian Brower, the Associate Director of the Fire Service Institute, and Kristen McMurray, the Associate Registrar for Facility Management and Scheduling. As always, our format will involve some opening comments. Today they'll be by Matthew. We'll get some brief presentations by all of our panelists, and then they'll answer questions that we received and feedback submitted through the Return to On-Campus Operations form that many of you filled out. Matthew, would you like to go ahead and offer us some opening thoughts?
Thank you, Robin. And thank you all for joining this briefing. Though issues related to safety, space, cleaning are not represented by any one Return to On-Campus Operations team, these issues cut across nearly every aspect of our university operations. And these issues are vitally important as we continue to navigate the impacts of the COVID pandemic. Brian, Mohammed, Kristen, and I are all members of the Executive Steering Committee, and we've been working very closely together to develop processes and procedures for the physical aspects of on-campus life. Every single member of the university community, whether you are a faculty member, staff member, or student, will be affected by these actions. If you are a student, you need to be confident that the university is maximizing your safety when you walk across campus, enter your classroom, go to the union, or find a study space. If you're an employee, you need to feel confident entering your office, sharing university resources, walking across campus, and navigating your office space. These actions that used to be routine or even mundane are now critically important safety points, and we want you to understand all of the processes we are putting in place for your safety. As you will see from their presentations, the individuals you will hear from in a few minutes are incredibly good at their jobs. And acting as co-chair for the Executive Steering Committee, I have seen firsthand what can happen when units partner together for the good of the university community. The reality is that many other organizations will not be able to reopen at the level that we will. And the reason we're able to do so is because we have tremendously talented, smart, and innovative people working together to make it a possibility. Our hope is that this presentation instills confidence as you prepare to return to campus. Thank you all sincerely for your patience and understanding as we navigate these issues together. With that, I'll let Robin get us started.
Thank you, Matthew. Very well said. And again, as I said before we move to questions, we thought it would be helpful to have the presenters briefly walk through the basics of how the university is making plans for safety, buildings, and cleaning. And let's go ahead and start with Brian. Can you kick us off, please?
Thank you, Robin. The first thing we'll touch upon is the emergency planning side of this. As the university, we were responding to this emergency as it was evolving. We've had several committees and groups on campus, as well as out in the community, that started ramping up their activity as the pandemic was evolving. Initially, our infectious disease working group added members so that we were in touch with local hospitals, public health, as well as we're maintaining an international and a national understanding as the pandemic evolved. This is a group that it already existed. We just added members and they were meeting more often. Next, we expanded the Campus Emergency Operations Committee. This is a group that routinely addresses minor problems that come up around campus. They're all trained in how to mitigate and respond to a disaster. While this was larger than anything we anticipated, we were able to leverage that planning model we had in place so that we could be more responsive and more attentive to what the issues were as they evolved. One of the other advantages we had at the university is we host our own emergency operations center when there's an emergency. Most campuses don't have the resources that we do to bring experts together. We not only brought our teams together at the U of I, but we combined resources with the state and county and kept in constant communication as the pandemic evolved. That helped us ensure that the information we were getting was the most accurate, and that was especially important as things evolved as quickly as they did. As you're aware from Chancellor Jones's messages, we created an executive steering committee in April. And in early May, we started a host of planning teams that were working on specific needs of campus. Because we're such a diverse and decentralized campus, these planning teams are helping us dive into each of the unique issues that are involved with trying to reopen the campus safely and return to on-campus instruction. Even with all these groups, communication is a challenge. There's a lot of things that we all want answers to right now, but we have to do things in a sequential way versus simultaneous to make sure that our decisions are sound and to make sure that we're involving all parties. On the next slide, I want to talk about 4 things that we're able to do to maintain our individual safety. While as a campus, we're trying to create a structured environment that helps us all stay safe. At the end of the day, it's going to be our individual actions and individual contributions that not only impact ourselves, but help keep all of us safe, not only on campus, but in our community. The picture up on the screen is what the coronavirus looks like. It's called the coronavirus because of those red pyramid-shaped proteins on top that look like crowns. You need to think about these layers of defense as a layer that covers up that virus. The first one is screening and testing. We are internationally innovating in how to test for the coronavirus. And Marty Burke and his team spoke about that last week. Each time we add a layer, it's like adding a piece of Swiss cheese. We can cover most of the virus, but not all of it. For screening, we need to get in the habit of asking ourselves, are we sick? Do I have symptoms? And if the answer is yes, we must stay home. The second thing we can do is practice excellent hand hygiene. This is where we need to wash our hands for at least 20 seconds with soap and warm water. If we can't use soap and water that regularly, we need to make sure that we're using hand sanitizer. During the pandemic, as it was evolving in March and April, we at the University of Illinois were able to innovate, switched one of our campus production labs to be able to make hand sanitizer and distributed that across the state to help meet demand. It's another way that we were innovating and we were leveraging the power of the university to be a partner as the state figured out how do we respond. It's important to wash your hands when you change locations, when you cough or sneeze, before and after eating, and before and after using the restroom like we're all used to. The third layer that combines is blocking droplets. It's a little more complicated than just wearing a face covering anytime you're around other people. Some folks, like instructors, may not be able to have a face covering on because it's going to impact their ability to interact with students. We're looking into other alternatives that will allow the instructors to be well heard, as well as for people who need to read lips to be able to still interact in that way with the presenter. Blocking droplets may take the form of putting up plexiglass barriers or other dividers so that individuals don't share their droplets. We know that the critical way this virus is spread is through droplets from an infected person. The fourth area is distancing. It's not just staying 6 feet away from people. It also may involve, in some buildings, having one-way corridors. It's going to involve marking off seats in auditoriums and classrooms that we'll talk about in more detail. All of these things together, as you see on the slide, cover up the virus. It's still there, and there's no guarantee that if we do all of these things, we may not contract the virus. But by doing as many of these as practical, in addition with the different layers of safety we're putting in place at the university, it's going to lower our risk as much as possible. We can't take it to zero, but if we all work together and follow as many of these as possible every opportunity, we'll keep that risk to a minimum. I mentioned droplets, and on the next slide, I want to talk about how we think the virus is spread and what the greatest risk is. The best data suggests that the virus is spread by droplets. That means the virus doesn't travel on its own. The virus is very small, and if it traveled on its own, it would be able to pass right through a cloth face covering. But this virus doesn't spread that way. This virus needs to be in a bubble of saliva or respiratory liquid in order for it to travel. When it's in that droplet, it can be blocked by a cloth face covering. That's why wearing a face covering is so critical. You don't know if you have this virus. You can have the virus from 2 to 14 days prior to showing symptoms, with most people being able to share the virus with others from 2 to 5 days before they even know they're sick. That's why cloth face coverings that can block these droplets are so critical. You're at greatest risk if you're around someone for more than 10 minutes, within 6 feet or within what's referred to as that social distancing radius, and you're exposed to their droplets. That doesn't mean that they're coughing or sneezing on you. It just means that they might be talking and there's nothing stopping their droplets from getting on you and getting into your eyes, nose, and mouth. And that last piece is that it has to be someone that's shedding the virus. Typically, people shed the virus in the hours right before they start showing symptoms, which is especially why people that are pre-symptomatic and not yet showing symptoms must wear face coverings and must block their droplets. It's the only way to keep us all safe because we don't know if we have the virus. Even with testing, it'll give us a greater margin of safety, but it doesn't eliminate the risk. So do you need to quarantine if somebody in a classroom that you were in tests positive? The answer is no, unless you were within these criteria up above. If you were exposed for more than 10 minutes, less than 6 feet away, and they shared droplets with you while they were contagious, you may need to quarantine. And we've been working very closely with state and local public health to help ensure that our requirements for the university for employees to quarantine, when people can go back to work, when is it safe for people to go back to class. We've interacted with healthcare professionals throughout the state so that we can make sure we're giving the most recent and the best guidance possible. That's the end of the overview I have. The next couple presenters are going to go in greater detail with how we're maintaining these things. And my closing thought, please, please, please stay home when you're sick. In the United States, we're used to soldiering through when we're ill. We want to go to class when we're sick. We want to go to work when we're sick. We want to be the most resilient person in the office or in the classroom. But the reality is, if we don't change that behavior to staying home when we're ill, we are going to increase the spread of this deadly virus. So thank you, Robin. Now let's hear from some of the other folks on greater detail of how we're going to put some of these physical things in place.
I believe, Mohammed, you're next up for us.
That's correct, Robin. Thank you very much. And thank you, Brian. Good morning, everyone. Next step is cleaning becomes really an integral part of our process. It's a responsibility. It's a community responsibility. All of us have to participate in this. So as a first step, FNS have changed and made modification to its cleaning standard and its service levels in order to focus on COVID-19 related aspects. So, and those changes and those new service levels have been documented and have been issued to campus around mid-May. It's available on our website, and it was communicated in different ways of communication. Some of the highlights of changing our service levels, for example, is including an increased frequency for cleaning restrooms, for example. So it moved into twice daily instead of once a day. And that obviously will also initiate the need to change our shifts and how we work in shifts to deliver our service. So that's also have been changed. Also frequently touched surfaces like doorknobs or push blades. So these are pieces that historically there was no focus on it. So that would be also disinfected with a CDC approved disinfectant. Private offices will not be entered unless it's really specifically requested. However, any waste that is left outside those private rooms will be picked up. So those are highlights on our service levels. If units have any questions related to cleaning or related to any especially required specific question to the unit, we've created that email you see on the screen, COVID-19 cleaning@illinois.edu. Please feel free to email to this. This email is seen by 3 of our leadership people in this group, and you should get an immediate response. It have been up and running, it have been used, and we have been responding to it. So please feel free to use it. Next slide. As I said earlier, cleaning and disinfection is a community responsibility. All of us are responsible for it. So units could also perform supplemental cleaning if needed. And what happens is we have worked with the Illinois HR and with our unions in order to look at what could be done. So the activities that you see on the screen, like disinfecting conference rooms, for example, before and after meetings, that is a desirable aspects to be performed, including partitions and sneeze guards. Shared vehicles, departmentally shared vehicles that would need to be disinfected before and after use, shared spaces, kitchenettes, coffee stations, wiping down reception areas and where visitors come and wait to meet with you. Those are also all activities could be performed either by faculty, by staff, by student helper, by extra help. We could perform that. Refilling hand sanitizers or containers in work areas, that's also an acceptable exercise that could be performed. Next slide. So in order to make this material available, we will have hand sanitizers available, dispensers available by all entries, not exactly in the entry or the exit of the building, because hand sanitizer is really, because of the percentage of alcohol, it poses a fire risk. So they will be in the vicinity of the entrances to the building, in the hallway somewhere, and it will be available there in a 2 liters containers for students, staff, and faculty to be able to use. Also, units will be able to order hand sanitizers from our central stores. As Brian explained earlier, we have worked with IBRL who were producing hand sanitizers, and we do have about 4,000 gallons of hand sanitizers right now. We also ordered these small ones, or the small hand sanitizers, the 8 ounce. But if it gets empty in your office, please don't throw it away, but call us and we can come and refill it for you. The picture you see on the screen is a disinfecting wipe dispensers that we've ordered to make it available in all classrooms, and it will be filled by a large number of probably like 300 or 400 pieces of disinfecting wipes, and that will be available in classroom. As I said, the students could help to clean. Safety shields and sneeze guards are also available for installation based on the request of units. We have worked on that. Our team is available to come and provide advice and investigate your workspace and provide and install those safety shields and sneeze guards. And all the material are available through the FNS stores and receiving. We can deliver to you, or you can pick up hand sanitizers and disinfecting wipes, and they are available at no charge to units. Next. For spaces, which becomes very important, the whole social distancing aspects, it's very important. All of us will have our masks on and maintain the 6 feet distance in our workplaces. So for non-classroom areas, and we say non-classroom because classrooms have a different process that I'll explain now, and you will hear from Matthew and Kristen in the next slides around how we're dealing with classrooms. But for non-classroom spaces, units could look at it. If you need help, we have our health and safety central response team that is available, and the email at the bottom of the screen, that COVID-19 fsconsulting@illinois.edu, you can seek this help, and we're committed to respond to your request within 24 hours of your request. This health and safety response team meet every day, daily basis, to review your requests and have a plan how to respond. It has our mechanical engineers, architects, health and safety professionals, tradespeople from the crafts and trades, that all a composite team that could provide you with one-stop shop to address all of your space related issue, whether you need to re-outline your space or look at your cubicles, at your workspaces, and how to make it safe, how to install sneeze guards if needed, and provide advices as you require. Next slide, please. Signage, we have worked with public affairs and with our colleagues in the union and developed signage for public spaces, either for main entrances, for elevators, for stairwells, and for restrooms. And those have been installed already. We printed and installed 11,000 signs or across campus everywhere to provide advice and provide best practices approaches for the different areas. And some stairwells were designated as one way in the regular usage sense. So in order to maintain people cross-passing each other, so you will find that certain narrow corridors or stairwells are going down only or up only. Obviously, in emergency cases, everyone will use the closest exit, which will be one way anyways, going down and to exit the buildings. There are also additional signs available on the URL that available on the screen here. If units need additional signs over and above the signs that are available in public areas, you need to print it and post it in your own specific unit area. You could access that box and print many of the posted signs that were created and deposited there by public affairs. Next slide. My last slide is around traffic control. And as you see on the video that will be played now, yes, the video started here. And what we've done is we did a simulation in collaboration with one of our researcher, Dr. Ouyang, in transportation and civil engineering, worked with his research team to develop a simulation. The simulation included different variables around the occupancy of the workspaces, and we have used the space you see on the screen. That's the largest lecture hall in Lincoln Hall building, and looking at how long it will take to evacuate the building based on the entrances and then refill the building again. And presenting or preserving values or variables such as distancing between students while they are exiting the space, maintaining 6 feet distance between each other, the occupancy of the spaces, and particularly occupancy is reduced because we're maintaining social distancing in every class. So it was found that spaces could be actually evacuated between 4 to 5 minutes and then refilled again. As you see on the video playing right now, the simulation for refilling, it's another 4 or 5 minutes. So in total, it's about 8 minutes or 9 minutes, mean that we do not need to increase the time between spaces while, the time between classes while maintaining social distancing process. And this will conclude my presentation. And now we'll hand it to Matthew and Kristen. We'll talk to you more about how we look at safety and social distancing in classrooms. Thank you.
Thank you, Mohammed. So I'd like to talk a little bit about the team efforts that have gone into this. If you've seen and heard from my colleagues and from previous presentations, everything we've been doing is really a team effort. It's about collaboration. We're bringing the best people together to work and address these issues to make sure that the health and safety of everyone is assured. And this is no different with the instructional spaces. So starting with the executive steering committee, we have that large oversight of all the teamwork so that we make sure that we're building those bridges between the teams, make sure we're communicating and sharing information. As Brian mentioned, already back in April, we were talking about, what will this look like when we return to campus? And so the academic team and our finance and operations team actually have been working collaboratively for quite a while now, since the idea about how instruction would be delivered was being considered. Will it be this hybrid model? Will it be some blend? And we're finding, in order to have some in-person activities, how do we actually deliver that execution? So the operations component of the finance and operations team has been focused on that. And this involved members of Mohammed's team early on as well. So the facilities and services engineering services team with Jim Sims leading the way here He's been engaged with us to look at the layouts of spaces. Likewise, Kristen's team, facility management and scheduling, have been working with us as well, because not only do we need to think about the capacities in the spaces, but then how does that impact the schedule overall as students have their course schedules in place. Professional services consultants, we've invited a retainer architect to participate with us as well. So an external architect to work with our spaces so that we have another set of eyes on things. And this is, again, collaborative effort. We have to constantly think about the technology services. This is something that's critical to delivery of instruction, not only within the classroom, but also for those who can't be in the classroom so that they're getting the information they need as well. And so key members on every one of the teams actually from technology services. And then the civil and environmental engineering team, as Mohammed referenced, is helping us with these pedestrian traffic flows to ensure that we're getting in and out of the building the right way in the safest ways. Next slide, please. So continuing with the planning, I want to remind everybody that the health and safety of faculty, staff, and students is the #1 priority. We're going to follow the science. We're looking at the CDC and the health officials on this information about what's the best things to do. Looking at, obviously, maintaining social distancing. That's that 6-foot separation, making sure that while you're seated in the classroom, that there's that 6-foot barrier for you so that you have that separation. I do want to emphasize as well that the ADA component of this is very important. We want to make sure that everybody feels comfortable coming into the classroom. So not only being compliant with the seat counts and access to the room, we're working with our disability resources and educational services team to advise us on the best ways of arranging this and making sure that there's equal access in the classrooms. You'll see in a moment some of the details about how we're keeping the instructors safe and having that 6-foot separation zone as well. And we want to make sure that this is communicated very clearly. Mohammed referenced signage. We're also talking, you probably saw in the University Life presentation, that there's information going out, trying to get as much communication out there as possible. Visit the websites, et cetera, to make sure, and actually these briefings as well are helping communicate to make sure that you understand what are the guidelines, what are the principles that we're asking you to follow. And then, of course, when we're actually arranging the rooms, we're trying to optimize the seating layout so that the space configurations, the layouts, we maintain the distancing, we have the ingress, egress, and it's clear that you have that safe zone. Hand things over to Kristen now.
Thank you, Matthew. So one important piece of the puzzle for determining the future fall class schedule is to identify new capacities and new room layouts using the CDC guideline of a 6-foot social distancing radius. So we are working with incredible folks at FNS, the design services team, and they're evaluating each instructional space for new seating layouts and capacities. And they're drawing up plans to maximize the number of students per classroom. As you can see on the slide, the 2 approaches they are using to ensure the radius for the student seating is being applied. In addition, we've already mentioned the instructor zone that is being diagrammed into each of these spaces that would have a minimum of 6 feet between the nearest student desk. We're working through our classroom inventory, starting with the largest spaces first. In case anybody was wondering how many traditional classrooms we have on campus, we have over 400 traditional classrooms that we're working through, and that doesn't include instructional lab spaces. Now, many of these may not be used by the end of the day, but we still have to go through this exercise and identify the number of seats we can get for each of those spaces. So we've been keeping both FNS and the individual facility managers very busy. As you'll see on the next slide, we have 2 samples of the rooms in Lincoln Hall, one of our biggest classroom facilities. So the diagram on the top shows the original layout of 2 classrooms. We can see with our tablet armchair standard desk, it normally would seat 49 seat students or 28 on the smaller classroom on the other side. If you move to the image below that, you can see the social distancing radius applied, and now those spaces can only hold 16 and 10 students. So our classrooms will have a very reduced occupancy rate, which will reduce the overall building occupancy rate as well. So what are we going to do with excess seating or furniture in those spaces? In the next slide, you can see our concept for theater or fixed seating spaces. And this image is what would the main floor of Follinger Auditorium will look like. We will have block eye decals on the usable seats and vinyl tape across the unusable seats. In classrooms with movable furniture, we'll actually be working with FNS again to remove the excess seating and store that furniture elsewhere. And the floor of the classroom will be taped off to mark where each seat should be placed and where it's going to need to remain throughout the semester. In addition, we will post a copy of the room layout and the new maximum occupancy in each classroom. And that information will also be available on various websites that share classroom information. So there are many wheels in motion to get us to the first day of classes, and we're very grateful for the team approach everyone has shown to accomplish this monumental task.
Thank you, Kristen. And thank you, everyone. That was a lot of really good information. I appreciate you getting so much out quickly, so we won't have quite as much to address in the Q&A section. As always, when we have these Q&As, we'd like everybody on the panel to feel free to respond. I will direct each question to one of you, but if anybody else wants to chime in, please feel free to do so. Again, please try to remember to mute and unmute your mics as appropriate. And Matthew, we'll go ahead and start with you. How do I know what my building plans are for my unit?
Thanks, Robin. Yeah, we've issued broad guidance for each unit, but each unit is making plans specific to their missions. So while we've offered the guidelines, each unit needs to look at what works best for their particular situation, the specifications, building configuration. The best thing to do is to talk with your supervisor about the specifics of the unit plans. But again, we have a wealth of resources of information on our web pages, et cetera, but your supervisor is the go-to person.
Great, thank you. That's probably always good advice, isn't it, for just about every HR issue anyway. Brian, the next one's for you. How are we deciding which safety standards we implement? I can tell you, as somebody who's helping with communications, sometimes they do seem to change with a fair amount of frequency.
You're absolutely right. There is certainly no shortage of information and opinions out there. I've been a first responder and healthcare provider for just under 30 years, and I've never seen the understanding of an emergency or a disease evolve and change as quickly as it has with this pandemic. A large part of my role on the steering team has been to verify and triangulate what we think, what's in the media, what's the experience around the world with how the virus is being mitigated, what works, what doesn't, what do we know is true, and what does the emerging science tell us? We know a lot more today than we did in February, March, and April. While the best practices have changed, we've had a consistent process with how we've identified what information we're going to leverage at the university. We've triangulated information through the emerging peer-reviewed research, through the World Health Organization, Centers for Disease Control, and the Illinois Department of Public Health. And then as a last step, once we thought we had it well understood, we reached out locally to the Champaign-Urbana Public Health District and made sure that they were comfortable with the direction we were going. If folks have unit-specific questions about how to apply things, or there's something they're confused on, they're welcome to reach out to me. I've been doing unit-level presentations to help people understand what we know and what we don't know at any given point in time, and I'm happy to share that with units as they have questions.
We are so grateful, Brian, for all your time doing that. I know you've been out and about doing a lot of those, and we really do appreciate it. Matthew, are we confident that we can manage all the safety standards necessary to repopulate campus?
This is a great question, and perhaps the most important one. As Brian just said, we've been following the science. We're making sure that we're following the latest information that we have, and we're applying that immediately. So from an operational standpoint, we feel confident that we can implement all of these standards. And that's changing the course schedules, mandating the face coverings, outfitting offices and shared spaces, et cetera. But really the most important critical part of this is every single person doing their part. It's up to each one of us to follow all the guidelines, from wiping down your shared surfaces to social distancing, even when it's awkward, and washing your hands, using hand sanitizer. We need to do it for ourselves, but we also need to do it for one another. We have to create a culture of self-compliance, basically. And we're working on several strategies to accomplish that.
Great. Mohammed, the return to campus guidelines say that employees have to wear a mask unless they're in a private space. And Matthew was talking about shared spaces earlier. What exactly do we mean by private space?
That's a very good question, Robin. Thank you for asking this. A private space really is a private enclosed office. So it's an office. Many of us will have offices that could be closed, so that would be a private space, a private office, or an enclosed space with partitions, and that is above head. Some of the cubicles or the partition spaces we work on are waist height, and that is not a private space. So in this case, we will need to have some changes and modification to the space to install what we call sneeze guards, or we provide those kind of barriers. And in any case, if a unit or an individual is in doubt whether the space is private or not, again, please feel free to connect with our Central Health and Safety Response Team. And again, they are available at COVID-19 FS Consulting at illinois.edu, and they will be happy to have an appointment and come and visit you in your work space within 24 hours of your email.
Very helpful. Thank you very much. Brian, we talk a lot about people wearing masks. You mentioned it in your presentation. You didn't say anything about gloves. Why not gloves?
While initially we saw a lot of people wearing gloves because they thought it was going to protect them, the current guidance from the CDC and the health department doesn't recommend wearing gloves unless you're either cleaning or you're caring for somebody that's ill. And the reason for that is if you're not trained with how to operate with gloves on, you're more likely to put yourself at risk or spread the virus through wearing gloves, taking them off improperly, and not disposing of them correctly. So the current recommendation from the CDC and the World Health Organization is if you're not using a cleaning chemical that requires them, and you're not caring for someone else, either in a home or a healthcare setting, gloves are not recommended.
But wash your hands.
Wash your hands as often as you can.
Great, thank you. Mohammed, we've heard a lot in the media about COVID-19 being spread through HVAC systems. I know my staff have raised that with me. Can you talk a little bit about how we're addressing that issue?
Yeah, well, as Brian said earlier, Robin, is the primary transmission of the virus is really from close contact exposure and not as an airborne aerosol. So that has been an issue, as you said, in the media, but the facts, as Brian explained, and as we all know, it is not as an airborne aerosol. And so the CDC HVAC recommendation is basically to ensure that our HVAC systems are working appropriately and as commissioned. And that what we are doing, and primarily focus on the availability of fresh air as per the standard. So the ASHRAE standard, we have what we call the ASHRAE 62.1 standard, which basically provide building designers, building owners, and building operators with the standards of the volume and the amount of fresh air that need to be available in the different spaces, whether it's a classroom or a lab or an office. So we are working, generally speaking, our building do have these levels. However, now we are working with our team. We have assembled a team, including mechanical engineers, including our energy management and conservation team, our crafts and trades, HVAC mechanics, and sheet metal mechanics and pipe fitters, that we're going around in every building and every air handling unit to ensure that the air handling units and the air provision is operational as per the standards and at a better actually level than the minimum standards as approved by ASHRAE. And this is a program we are working on right now, and we'll continue to work on it throughout the summer to ensure that all of our buildings are working, fresh air, filters, filtrations, and all is available as commissioned.
Great, thank you. And Kristen, you're sitting there in Follinger Auditorium, which makes my heart very happy to see you there. Yay. Tell us a little bit about how you're deciding what classes happen in person and what ones don't.
Yes, that's another good question. We are working closely with the units to ensure that their guidance about the academic experience is really prioritized. In fact, units are working over the coming weeks to identify the high priority courses that they feel need to have a face-to-face component. And we're exploring various scheduling options with them about how we can maximize space for as much in-person instruction as possible. For example, instructors could choose to have an attendance plan. So a portion of the class comes on certain days or certain weeks of the semester on a rotating basis. Or they could indicate that they want a classroom from one meeting day and they would handle the other portion online in sort of a hybrid manner. In addition, we've been trying to grab any non-academic space that we can and partnering with folks on campus who have nice square footage spaces we can acquire. And we're also looking at every teaching slot in the day. So that means from 8 a.m. to 10 p.m. so that we can really find space for as many in-person classes as possible.
And usually when you're putting together the schedule, it takes about how long? It's amazing to me how quickly you're doing all this.
Yes, it's normally a good 6-month process that we're going to do in 3 weeks. So special shout out there to the department schedulers and to my team and the Office of the Registrar, who every semester they do a tremendous job putting the schedule together and assigning rooms for their courses. But now they're going to have to redo all that hard work they did in January, and they're going to redo it in a tight time frame. So they've got some work cut out for them and working with their departments and space managers to put this puzzle together.
Well, thank you all. We do appreciate that. Matthew and Mohammed, I'm not sure who wants to answer first, but the guidelines do necessitate a lot of cleaning supplies. For my unit, how do I get those and who pays for the supplies? Is it a shared thing?
Well, yeah, I will take that question, Robin. For the units, the university is providing every staff member with 2 masks to wear, and also we're making disinfecting wipes and hand sanitizers available at no charge to the unit. So the unit contact, and please work through your unit contact, who will connect with our central stores to order the required disinfecting wipes and the required volume of hand sanitizers. And as I said, we did an estimate of probably the required disinfecting wipes from now until end of December, and we came up with a number of 11 million disinfecting wipes. So our central stores now, we have right now about 1.5 million of those, and we have an order another 6 million, and we continue to order in order to ensure that they are available. Hand sanitizers, same thing. We're working with IBRL. We have 4,000 gallons available now from central stores in order to avoid duplication if the subunits make an order, because I know that many of our colleagues have cross appointment in more than one unit. So we want to make sure that to avoid duplication and make sure that we have material that covers all of our needed community needs. So orders through the central stores, and it will be delivered to you at no charge, as I mentioned earlier. Thank you.
Matthew, did you have anything to add to that, or did you cover everything?
Mohammed did a great job of covering it.
Mohammed, yeah, thank you. Kristen, I would like to ask a little bit, in your presentation, you were showing the classroom layouts and things, and I know I had kind of assumed that rooms might be half capacity or a third capacity, something like that. It does seem to have a pretty wide variance. I've seen some that are 20%, some at 35%. Can you explain how that discrepancy happens?
Sure, and at this point, I'd take 35% for all of them if I could, but different classrooms have different layouts and configurations. And for example, some classrooms have movable furniture and some have tighter theater seating rows. So the actual capacity is based on our ability to have individuals maintain safe social distance in their seat for that particular space. So each room's getting a custom layout and a custom new capacity. And that's why we can't just drop all room capacities by a set percentage and feel good that we've done all we can to provide the distancing in the classrooms. So again, shout out to the design team and the facility managers who are going in with tape measures and in AutoCAD and coming up with these new layouts. It's a tremendous amount of work.
That's great. Thank you very much. Matthew, obviously accessibility is really important to us all. How are you factoring all of that into space planning?
Robin, as I mentioned earlier, this is critically important. And, quite frankly, we take great pride at Illinois. I mean, we've led the way on accessibility needs and address these issues for a long, long time. We have a long history of this, and it's critically important for us. this has to be factored into every aspect, meaning not only within the classrooms, how do you navigate the rooms as we rearrange and make it more complicated in the rooms, but also just the ingress, egress out, in and out of the buildings. What about across campus? All aspects. And it's vitally important we maintain that high level of accessibility in all of our buildings, quite frankly. And so that's why we're working with not only the code compliance experts, our architects are trained in this way to make sure that they're considering all of these factors when they lay out a classroom, but also consulting with the professionals we have here on campus. There's so many talented people. So disability resources, educational services, they're on our committees. We've actually taken the time specifically to talk about these classroom needs to make sure we're not missing anything. And so once again, it's a team effort, really looking at this just critically important. So, it's equality for all in this access to the classrooms.
And as a follow-up, how are we calculating the social distancing square footage? I understand 6 feet, but it's kind of all around a person. How does that work?
Yeah, so it is a radius, looking at, basically, as you said, 6 feet around the individuals. And so Kristen shared slides earlier, and it showed that there's basically a 13.3 square foot seating circle around the seating. And when you're looking at the hexagonal layout that was showed earlier, and then a 16 square foot per seat in that square layout. And, again, it's the added layer for the instructor, making sure that there's the minimum of the 6 foot of separation from the instructor to the nearest student. And all of this follows the science, again, the CDC guidelines. And quite frankly, in thinking this through with these different, especially with the movable furniture spaces, it allows us some flexibility in thinking what's the best configuration for the space for the type of instruction that's going to occur as well.
Mohammed, you had addressed in your presentation that you had the illustration of the passing period. Can you talk a little bit more about the whole idea of doorways and hallways and how that all is going to work? Because that still seems a little frightening.
Yeah, well, thank you, Robin. The doorways and hallway spaces, we're looking at the traffic patterns in the building. And as you've seen the video and the simulation, we worked with our experts as well in civil engineering to look at that simulation. And we continue to work on other buildings as pilots as well. And in all of that, we look at the capacity and the occupant loads, the predicted occupant load in the building, and the proximity of the exit doors, the width of the hallway, and look at possibilities of making some hallways one way, for example, if we have a narrow hallway, if we have a longer distance from exits or doors. However, what I think what we're missing or not missing is the idea of the social distancing is reducing the occupant load significantly. So, for example, the Lincoln Hall was in the simulation. In order to maintain the 6 foot distance with the circle for the instructor, for example, that means the front 2 rows, no one will be sitting there. And then every other row will be lost as well. So you find at the end, after maintaining the social distancing, is you find that the classroom or the space capacity goes down by about 70%. So we'll be utilizing 30% of the capacity. So the number of the occupants, number of students coming in and out of particular building will be reduced significantly. And that's what the simulation revealed. So, and based on that, we don't think that we need to increase, for example, the period between classes. If we looked at the simulation and we found that if we increase the period between classes, that means that will allow students, staff, and faculty to walk slower and to maintain longer than 6 foot distance, which is not obviously needed. So, as I said, this is the exercise that we've done, and we will continue to post signs as needed based on the results that we have. But we're working building by building in order to finalize this.
Brian, the idea of the passing period being relatively short, that kind of factors into, or? Oh, and I think you're still muted, Brian.
Going back to those 4 layers of protection, that factors in here too. The people that are symptomatic or the people that are shedding the virus are home, or they're wearing a face covering so that they're not producing droplets or sharing those droplets as we're passing in the hallway. We know that our time spent with people in the hallways is going to be less. We have to get in the habit of staying 6 or more feet behind the person in front of us, the people next to us, and not everybody leaving the building all at the same time. It'll also be important to keep hand sanitizer with you, use it as you enter and leave the classrooms, and just use that combination of layers to keep yourself safe.
Great, thank you. And Mohammed, I grew up in a time when all the buffet restaurants were starting, and it was called a sneeze guard then. Now we call them just a shield, a plexiglass shield. How do you know when you need to put one of those in or when you don't in your building?
If we are working on a private office or a private room, or working on a cubicle or a workspace that is a full height wall above the head at least, then we don't have to put those, and we don't have to use mask. If we are working in a condition different than that, then we need to have the mask on all the time, or we install those shields or those sneeze guards. And as I said earlier, our team is available. We have a composite team that can help if there is, based on my answer now, if there is still a question or not sure, please feel free to connect with our health and safety team at COVID-19 FS Consulting at illinois.edu, and they will be able to visit. But generally speaking, that will be the idea. Full height wall or private office, you don't need them. Waist height or lower, then you need to install them.
Great, thank you. And Matthew, we've been talking a lot about this fall, but there are people who are on campus now. Kristen's sitting right there right now. How many buildings are actually in use right now at this time?
You know, it's interesting, Robin, because the buildings actually have had controlled access for quite some time. You know, people that either couldn't work remotely or found it easier to work with in their offices, or you know, essential work that needed to be done on campus as well. So there's been card and key access for quite a while. And actually, kudos to Kristen and her team, because they control that schedule of what buildings open and the standard in which it is scheduled, whether it has set open hours, for example, or if it has the card and key access only at any given time. And, you know, we know that many of the researchers, for example, are back on campus, and this is just, you know, the nature of what they do. Their work requires that they be in their labs. So about half of the lab researchers are currently back on campus. Large portion of Mohammed's team, all the FNS workers, are back on campus as well. Again, just fairly important work that they do. And so that have been on campus for some time now. And we just expect that number to increase as we continue to gradually and strategically return between now and August 16th. So you're just going to see more and more. And a lot of that will have to do with, you know, scheduling, working with the supervisors, and then, of course, again, contacting Kristen's team to make sure that the hours are set properly and published.
Great, thank you. We have all learned a lot over these past few months. I think this has been a situation obviously unprecedented because, you know, we've had lots of challenges the university has faced, but I don't know that we've ever had one where we all faced it and all of our peers faced it and all of our friends and family and everybody faced it. I'm curious, are there things that you've learned to do differently that you will likely continue to use or implement after COVID is long gone, we hope? Brian, would you want to start us off, and then anybody else can add in if you have something?
I think from an organizational change perspective, we're going to get the behavior we tolerate. And within my unit, it's required a lot more gentle reminding, both from the students up to the instructors and from the administration to the employees, so that everybody's remembering that the reason we're doing this is because we're in this together. And I think there's lessons I'll take away for how to bring change into other areas. The other takeaway is that we have such a robust set of resources on campus. There are very few questions that have come up or that I've been asked where I've had to go beyond campus to get an answer. I might have gone beyond campus to triangulate the answer or make sure that other groups are thinking the same way we are. But it has truly amazed me the depth and the breadth of capabilities that we have just on our campus, and how our state has leveraged those to have a better statewide response.
Great, thank you. Kristen, how about you? Anything you've learned?
Well, I think one of the best things that has come out of this is the collaborative spirit across campus about space. We've become less territorial about this is my space, this is campus space. if we want to have classes in the fall, this has to be our space, and we have to really pool our resources together to make this happen. So we've had some great partnerships with the auxiliaries, with other academic units, and it's really great to see us all pulling the resources together so we can have as much face-to-face instruction as possible.
Well said, yeah. And Mohammed, your unit has carried such a heavy load. What have you all learned?
Well, really, I mean, what I would say, I'm very proud with the team that I'm working on. And I believe really what we observed and we learned is how we looked at that challenge as really an opportunity. This is always something we always believed in, is every challenge bring an opportunity with it for the team to shine and to really, show what value or what service could provide. And the team really did rise up to the challenge, and it was used as an opportunity. And we were able to see the values of agility and perseverance really at play. How we were able to change very quickly and with ease. Our team has changed about 4 or 5 times our business process, and as we ramp up and changes the way how we deliver service and how we support the campuses. So agility and perseverance became very important component of our makeup and what we do and how we can we deliver service. What we learned as well is, I think we don't know what's coming. So I think some of the precautions that we have all undertook, the social distancing, the continuous disinfecting and cleaning, probably that becomes part of our fabric, and to be able and ready to change and respond very quickly. So it has been really a very valuable experience for all of us.
Great. Matthew, how about you?
I think I'll just add to what each of my colleagues have said. I mean, this has just been really impressive. The people have come together, spirit of collaboration. They've adapted to a highly unusual circumstance, brought their talents together. People, volunteers, step forward to help with things. I think what this says is a lot of what I feel like that what we've kind of known about the Illinois family. It's a great place to be. People really do look out for each other. There's incredible talent here. And I think that, interestingly, having to face something that was so unknown and unprecedented says a lot about us. We're going to take that forward, feel like we can face any challenge and come together and figure it out, solve the problems and be innovative for the future. And I think that's that entire spirit that we have. This has just helped us to really bring it forward, and very impressed and quite frankly, very proud to be part of this team.
Well, I was going to ask you for some final comments, but I think those might have been them. Did you have anything else you wanted to add, Matthew?
Just a few comments, Robin. I opened session saying that every single member of the university community is affected by the actions discussed today. As you can see, there's a lot of dedicated people working to ensure that we have the right processes, procedures in place for a safe return to campus. But really, again, the responsibility doesn't end there. It's each one of us has to exercise personal responsibility and follow the safety guidelines. I mean, that's again, wearing the face coverings, maintaining the social distancing, washing your hands, using the sanitizers, wiping down surfaces. And we're going to keep saying this. You notice this. This is something we have to keep repeating. But we need to do this for our own safety and well-being of our colleagues, and quite frankly, your friends. Just keep that in mind. This is about family and friends. You're thinking about taking care of one another. And finally, I just want to thank everyone for their input, the hard work, and the collaboration. Thanks, Robin.
Thank you very much. I want to thank all of our panelists, Brian, Mohammed, Kristen, and Matthew. We really appreciate you taking the time today. It's very clear you're all very, very busy. That was a great briefing, though. We are going to take off for the 4th of July holiday next week. Our next briefing event will be July 16th, covering the topic of athletics, which is of great interest to a lot of people. You'll be able to watch that briefing using that same link that you're using today. All the briefings, as always, are recorded and posted on the covid19.illinois.edu website. Another special thanks to our producers today, Allison Vance, Chris Harris, and Brian Mertz, and a very special thanks to our tech partner, Rick Lindquist. Thanks to each of you who tuned in to learn more. We really appreciate you taking the time to stay up on all of the latest news. We will talk to you soon. Have a great holiday and a great afternoon. Bye-bye.